Okay.
All right, so I show up in the morning and I see that I have a new order for my patient geriatric via FIN 261-824-375. I see that the order is for packed red blood cells, 1 unit over 2 to 3 hours. So I'm going to be giving that. I first checked for consent and I see that Jerry has given consent and that is still, it's signed off and it's still valid. So we're good. So now that he's consented to the procedure, I'm just going to get this primed and then I'm going to get a second nurse to do the checks with me. So I have my YSET blood tubing here. I'm just going to take this out. Oh, you know what? Denise, can I have more gloves? I forgot to restock on gloves. Gloves. Large. Thank you. I need more gloves because there's not gloves in every patient room here. That's what nurse here. Alright, so I'm just going to make sure everything's closed.
I'm making sure my fingers are awake.
And so now I'm just going to attach this in an aseptic manner. I'm going to take off this cap here. Just going to take off this cap here. Okay. So now it's open and it's flowing. So I'm just going to squeeze it to go get it completely over the filter. And now I'm just going to open up my clamps here. I'm going to open this up. And I'm going to open this up. And I'm just going to allow it to run completely to the very end. There might be some residue showing, but we're good. There we go. And now I see it's at the very end. So now I'm just gonna check and I see that I filled the 2/3 here and it's completely primed. There's no bubbles and I've closed everything off as well. So at this time, I'm just going to close off my normal saline here since I won't be needing that anymore. I'm gonna grab my blood bag that I need. And then I'm going to get a second nurse to help do the checks with me. And I'm just going to get this out of the way. So I got a second nurse. She's here. So we're going to do our first check together. We're going to do the record of transfusion compared to the demographic sheet. I'll be working from the record of transfusion. And we're just going to read off the patient name. So patient name is Geriatrique. Last name Atrique, A-T-R-I-Q-U-E. First name Jerry, J-E-R-R-Y. And his FIN number is 261-824-375. So now that I see that those two match, we can move on to our second check. And we're just going to read off from, she's going to be working from the blood tank, I'll be working from the record of transfusion still. So I see that our patient is Geriatrique. His last name is Atrique, A-T-R-I-Q-U-E. First name Jerry, J-E-R-R-Y. His FIN number is 261-824-375. His blood group is AB positive. His component blood group is AB positive. He is receiving packed red blood cells, and it says that it will be, well, I guess it'll be on here. And so his donation number is C051008900445, line of box. And the component expires 1 month from now, so we know that this is not expired. His cross match expires 3 days from now, so we know that his cross match is still valid. And so now that we've checked everything in between these two, we're just going to move on to comparing our third check, which is going to be between the blood bag and the blood tank. So I see that this is for Geriatrique, and so he is going to be getting AB positive blood because that's compatible with his AB positive blood type as well. And that it is red blood cells, and so we see that it is red blood cells and that matches. We see that his donation number is C051008900445 line of box, and we're comparing those together. And yeah, like I said, it's not expired, and there's no abnormalities with the bag. So now that we've checked that it is AB positive and it is red blood cells, then we can just move on. It's not expired. So now we've done all 3 of our checks. So I'm just going to gather my supplies and enter the room and introduce myself. Hey, my name is Melannie Teitsma. I'm going to be your nurse for today. I'm here to give you some red blood cells, but before we get started, can we just check your name tag? So my second nurse is going to be looking from the blood tag. I'm going to be looking from his band here. Can you just state your name for me? He says he's geriatric, and I see that his name is geriatric, so Jerryytrique, so that was first name, last name, and she acknowledges that matches. And his spin is 261-824-375, and that matches here as well. And how old are you? He's 52 years old, so we know that we have the correct patient. Before I get started, I just see that I have an IV emergency line here in case there is a transfusion reaction, so that's something that I checked as I was going into the room. Okay, so Jerry, what we're going to be doing here today is we checked your blood count this morning after surgery, and it is really, you don't have enough red blood cells, it's very low. So the doctor decided that he wanted to give you some red blood cells. So we're going to be giving you this bag of blood over 2 hours. So you already consented to this procedure. I'm just going to explain it again and then just checking you still consent, okay? And so you acknowledge that's okay. So for blood receiving, we already checked your blood type and you're AB positive, and the blood that we're giving you is also AB positive, so it should match. However, some side effects that can happen are called transfusion reactions. Stuff that could happen is if it's not quite matching to your blood, and so it could be you feel like you're getting really hot, you're having a fever, difficulty breathing, hives, itchiness, anything that you feel is just not quite right. Your call bell is here, so you can call us if needed. Yeah, so if you feel anything having a transfusion reaction, just let me know. I'm going to stay with you for 15 minutes and just make sure that nothing bad happens in those first 15, and then we're going to go on from there, okay? So have you received blood before? And he says that he has received blood before, so I'm going to choose to do it at a 2-hour rate in total instead of, because our order was for 2 to 3 hours, but since he's received blood before, I'm going to just do it at 2. Okay, so Jerry, as well, after the 15 minutes, and I take your vital signs, and I'm going to take them again at hour increments until the end of the transfusion, when I'll take them again, and then an hour after the end of transfusion, okay? So I'm going to be taking your vital signs quite a bit. Do you consent to this procedure? So you consent. We did the right assessment, evaluation, education, and the right to refuse. And so we do the right to document afterwards. So far we've covered all of our rights that we need. So before we go anywhere else, I'm just going to put on some gloves. And I'm going to spike my bag in an aseptic manner. So just verbalizing again that I see that this is close to my normal saline. Okay, back out my bubbles, and we're just going to open it here. And I would have 5 ml in here, but because it's lab, there wasn't enough. So I'm just going to aseptically take off this lid here. And take off this cap here. And then spike this. And I'm going to alcohol switch. Okay, now I'm just going to slowly open this and allow the blood to run through. And I'm going to draw on 5 ml from here so that I have 45 ml in this bag. So it's not running through very well, so I'm just going to be squeezing my filter here. And then I'm also going to now I see that it's running a bit better. And I wanted to run all the way down to the end of the line here. With the key, and then I'm going to take out. So now that I've done that, I'm going to do my second check. So I'm just going to start with the right patient. Okay, so since it's not running very well, I'm just going to take off the cap here. Just loosen it. And the hopes that it will come down to me. Okay, now it's coming. And now I'm going to just make sure that it's all registered. And now it's at the tip. So it's hard to see because I was bent over, but we ended up getting the blood right to the tip in an aseptic manner. So you can see it's kind of pinkish all the way down. So in that way we can make sure that we have vein-to-vein contact. So while I'm here during the first 15 minutes, he'll be receiving only blood, not just normal saline from the end, okay? So now we've completely primed it and everything, so I can take off my gloves and just move to my pump. Now I'm just gonna click and then open here. Primary, open, and I'm just going to open. And now I'm gonna load it. Come on, baby. I'm gonna try and load it again.
I'm going to check my throat, so PCIV, this is IV, and then I know what's here, and then
it worked!
once I've done that, I'm going to get my second nurse.
Oh, okay. So while I'm here for the first 15 minutes, I want it to be running at a rate of 15 cc's per hour, so I can make sure that it's running very slowly and I can detect any transfusion reactions. And then after those 15 minutes, I'm going to adjust it so that it will be completed after 2 hours, and we're going to adjust it to 197 cc's per hour, okay? So now that I see that everything's okay, and I entered in the volume, this is 358, which it says on here, right here, but I just do that in my head anyway. So now that I have everything here, I am just going to, and like I said before, we have our emergency line, and if there is a transfusion reaction, what we're going to do is we're going to unhook the blood immediately and then start running normal saline through him. So that's why that's there. So I'm just going to swab that for 30 seconds, let it dry for 15. Open this up. And I also see that it's intact. I don't see any infiltration here. So we can use this. It's always best to give blood through an IV. If you give it through a CVAD or a PIC, it could possibly have some electrolyte imbalances, especially with potassium, and that's not something that we want to do to our patients. So now I'll just unhook this and allow it to keep facing up so that I don't contaminate it. And I'm just going to unhook here. Okay, and I'm just going to attach. So I have my vein-to-vein contact here. I'm just going to open up my clamp here. Make sure this is open here, closed here. And I see this okay, so I'm going to confirm primary. And now that I see that everything is okay, I'm going to click start. So like I said, I'll be here for the first 15 minutes and taking his vital signs in increments afterwards, as I already verbalized. It should be done by 2 hours. And we're just going to be monitoring for any transfusion reactions. And we're going to be checking his blood count after to check that everything's okay. We just want to make sure that we do our documentation in the right spot, and also make sure that my second nurse is included in that since she helped me with all 4 of the checks. So now I see that my patient's call bell is within reach and his bed is in the lowest position, and this is running. I can see the drips, and we have our emergency line, and it's running at 50 cc's per hour. So now that everything is running and everything is good, I can just end it at that. Thank you.